Hi, today I will be discussing a recent meta-analysis by a Chinese group of authors published recently in the journal Frontiers in Endocrinology. The authors attempted to answer a very pertinent and difficult question that is still largely unresolved in modern medicine, which is in patients with a diagnosis of deep endometriosis and associated infertility, what is the best primary method of management? Is it primary surgery for endometriosis or is it primary IVF? In real-life scenarios, the majority of those patients are likely to undergo IVF for a number of potential reasons, including fear of surgical complications, fear of diminishing the ovarian reserve by surgery, and a higher number of IVF centers compared to expert endometriosis centers worldwide. In this particular study, the authors included 6 original papers. 4 of them were deemed to be of high quality, and in short, they identified comparable outcomes in terms of the primary outcomes, which were cumulative pregnancy rate per patient per cycle and live birth rate per patient. So they identified comparable results between the two approaches. However, when they did further analysis of those studies and took out one of the studies that was causing a lot of heterogeneity, was changing the results, they identified a shift towards improved, better outcomes in the surgical group rather than the group of IVF. Of course, every study has its limitations, and certainly in cases of endometriosis there are some limitations that are come hand in hand with the disease. One of these is the heterogeneity of the disease. For example, it is difficult to compare the effect on the reproductive outcome of a deep endometriosis bowel nodule compared to a deep endometriosis nodule of the uterosacral ligaments, and one may think that excising the one lesion, it is difficult to compare with excising the other lesion. The other thing is the difference between surgeons. For example, the term complete excision of endometriosis may differ significantly between centers and between countries. However, and bearing all those things in mind, I think there are 2 particular important things that come from this study. One is the fact that we desperately, urgently need more original studies comparing the 2 approaches, ideally in a randomized setting, and I am aware that there are some studies currently ongoing, so we'll hopefully have them results reporting soon that will guide the practice accordingly. But number 2, it is also very important to acknowledge a potential paradigm shift towards surgery with those patients with deep endometriosis and infertility, particularly the symptomatic ones. I would recommend that referring all those patients directly to IVF without considering expert surgery, particularly in the light of that recent meta-analysis, should not be considered in all cases. I think that excising deep endometriosis in infertile patients should be discussed thoroughly with the patient and potentially favored over IVF in certain scenarios.